Welcome to the Visceral Voice Podcast. I'm Christine Schneider, your host. Through this podcast, I aim to bring you the most current, up-to-date research on voice science, function, pain science, movement, and everything in between. I am on a quest to learn everything I can about the living, breathing body and its intricate connection to the voice. This podcast documents the continuation of my learning and my experience as a professional singer, a biomechanics specialist, and a manual therapist. Join us as we strive to provide current, knowledgeable, creative, and compassionate information to help you restore, regain, and create happiness and success on your vocal journey. Hello, everybody, and welcome back to the podcast. I am joined today with my friend and colleague here in Virginia Beach, Katelyn Swiader. Katelyn, thank you so much for joining me today. I'm super stoked on talking to you about something that I actually don't use very often and don't know a lot about, which is respiratory muscle training devices. So, Katelyn, thank you so much for joining me today.
It is such an honor and privilege to get to contribute to your community. I am very passionate, like yourself, about education. And there's so many things that you and I have spent many years to learn about. And we think to ourselves, why did it take so long to learn something that would have made that whole journey so much easier? And for me, that's respiratory muscle training. I saw it personally in my patients' lives. And as a clinician, I'm a speech-language pathologist. My specialty is voice and upper airway, and I'm a professional opera singer, and I'm still touring in a rock band right now. And I've been a vocal coach for many years, have a degree in vocal performance and a degree in speech pathology, but yet I didn't know the pivotal role of the respiratory muscle training component. And you know how as performers, we're like, okay, am I connected to my breath right? Am I using it? And we just take years to master it. Well, when I used the breather, it was seconds. And I was just flabbergasted. Like, that is the relationship I've been seeking. How come it's taking so long? And then before that, I had patients that I didn't know what to do because I gave them all the things. And I knew about other RMT, respiratory muscle therapy devices, respiratory muscle training, but they were lacking that inspiratory component. And once I added that, I saw really big changes for my patients.
Cool. So that's sort of an introduction. I'm going to go back just a little bit. So you mentioned that you're an opera singer. You are currently singing with a rock band, so opera and rock. You're a speech therapist as well as a singer. So let's just kind of start with a little bit more about your journey into becoming a speech therapist and then, your journey into the work that you're doing now, and then we'll come and kind of narrow in on the respiratory training.
Yes, and I know I gave kind of a really big intro, but
no,
it's so excited.
Yeah, it's great.
So my origin story is I wanted to be the Little Mermaid growing up, and I wanted to be in the MTV Music Video Awards. I had really big goals, and I asked my mom for voice lessons. I actually hunted down a voice teacher myself. I heard about a girl, let's say I was in third grade, and I found out that she had a voice teacher, and I just was like, someone can teach you to sing. I want one of those. So I got off the school bus. I handed my mom the voice teacher's number and said, this is my music teacher now. And I started singing lessons, and automatically we started with classical music. And that's not really what I wanted. I'm so grateful for it. But now we have children beginning lessons, and we are more open to different genres to learn rather than like classical is where everybody starts. And that's not necessarily the case. I'm grateful for that. Loved it. Pursued to be an opera singer. Actually went to high school, the Governor School for the Arts. And I had the privilege to actually teach there years later. And I got a degree in performance. I was pursuing to be a professional opera singer. I was staying in different countries. Then I managed an opera company, and I was in charge of hosting and running auditions in New York City, looking through the resumes, selecting the artists, making contracts. So that was really helpful, teaching me about the demand of the life of the singer. And when you are managing an opera house and the artist schedules, you see the extra voice demand that many voice teachers don't know about, and neither does a clinician. So, long story short, I knew I wanted to be a mom, and auditioning for jobs that would last for like a week or 3 weeks or 3 months, I kind of was confused and lost, but I always loved the rehearsal process. Ever since I was little, and I actually had my first role in an opera when I was 14. And I had the privilege of singing and touring with an opera company, and I was the first spirit. My understudy was a foot taller than me, and it was the week of opening week. My voice was raw. I had a sound that wasn't coming out. They sent me to an ENT, and they were a laryngologist. I didn't know that at the time. It took many years to learn the word laryngologist, which is, again, something I like to bring early on in education for people. And I saw my voice, and I was fascinated. I saw the vocal folds, and I sat on the floor the day after my appointment. I was like, do I want to be an ENT or do I want to be an opera singer? At Barnes & Noble's, I saw that you had a very long path of science, and I didn't think I could do all the science. So I got a degree in performance. And along the way, I found out this was speech pathology, and that's really where I needed to be. So after a degree in being an opera singer and managing an opera company, learning about the life of the artist, I went back to school and got a degree as a speech pathologist. Yeah. And even after all of that, I still could have worked on my breathing. When I found the breather, that is when it clicked.
Yeah.
And it's not just the breather. It's respiratory muscle training. It's so important.
Yeah. So I want to come into RMTs, or respiratory muscle training, or EMTs or CRMTs, and go ahead and explain to those in the audience or those listening that might not know what those are.
Yeah. So you can call it respiratory muscle therapy, respiratory muscle training, and it is a variety of options. You can have a resistive base, kind of like a resistance band, or a threshold based. And that is more like you have to hit a pressure threshold and then you know that you've done it. Those are two versions that are out there, but in the topic of what is RMT, respiratory muscle training, you have inspiratory muscle training, IMT, expiratory muscle training, just EMT, or what's one of the more rare ones, which is CRMT, combined respiratory muscle training. But so few devices do inhale and exhale resistance training or pressure threshold training. That CRMT piece people don't know so much about, so we just call it RMT.
Okay. So I'm gonna like jump right in. I have had one part of my life that very much comes back to RMTs, and that was directly after thoracic surgery. So right after thoracic surgery, while I was in the hospital, I was given some kind of device with a little ball, and I had to blow into it. I was still kind of comatose. I mean, I was very much hyped up on morphine. I had to be introduced to this training right away. However, being introduced to this training, and I was 15, what was said to me was, if you don't do this and continue to do this with me, you will get pneumonia and you will die. So respiratory training became very triggering for me. I mean, it would kind of throw me back into PTSD. And so one, I want to recognize that because I've been there, and we'll be doing we've like played with this very briefly. So I've barely done the breather. And so in a little bit, we're going to play around with the breather, and I'm introducing the fact that I have had PTSD around breath training. I've had to really work in order to work with breath training in all of the work that I do now, and recognizing that adding more demand could potentially might potentially bring up an emotional component because of my history.
Yeah. And I'm sorry that that was approached to you that way. That's terrifying. And as someone so young and going through something so big that your colleagues really couldn't relate to. And you had to go through that as a young woman, and your friends were just probably couldn't get it. And you had to be sensitive, but you also had to work to get back. And I'm sorry that the way it was introduced to you was in a life or death scenario. And we got to really work on our bedside manner. So as a friend and colleague, I have a rule whenever it comes to any time I work with someone. This is your body. This is your body. I don't want you to do anything you're not comfortable with. 2, it's our job as a clinician or the teacher to respect that. And also to provide the education of like, hey, this may benefit you but if you're a hard stop of I'm not comfortable, I'm here to be open to that, because I have had teachers who just didn't care. And they pushed you to where you're not comfortable. And I literally stopped singing for 10 years because it was not enjoyable, the education, the learning. And I had to heal from that. So I am here to take it slow with you.
Yes, thank you. And I do appreciate it, which is why I'm sitting with you to discuss these different devices as opposed to potentially sitting with someone else. Great. So when you start working with someone and introducing an RMT to them, I'm now in your clinic. I want to see, how do you start bringing this therapy into the work, and what demographics that you probably use it with are pretty vast. So maybe we'll say, introduce me to how you introduce it into your clinic, and then go ahead and let us know, who might you not use this with?
Yeah. Anytime we breathe against a tube, we are like our body, we have a tube. This is our tube. But if we ever change the size of our lip or the pressure, we talk about the straw, that creates a different resistance of where your air is being exited out of. So that is equivalent of what this is doing, but you have many levels for inhale to exhale. Other devices, you have to push with great force to be able to essentially lift a weight. And I like to think of this one as literally a resistance band, that the resistance band is one of the first ones you give people when they're starting their therapy. Like I had it in OT and PT, and it's gentle, and you can bring it along for the journey. You can do more dynamic things. You can challenge yourself, make it harder. Same thing with that. So when it comes to other RMT devices, respiratory and muscle training devices, you may have to wait longer. You may have to have the right posture to do it. You may have to work harder than you're comfortable. If you have the breather, so I'm going to specifically talk about that. I've had people with half paralyzed diaphragm. I've had people with significant reduced lung capacity. I've had people who are recovering post-surgery. Who is it not right for? Someone who has a eustachian tube imbalance, because when you are breathing against pressure, you're bringing air into the head, and the eustachian tubes, if they're not able to do their job, it can be uncomfortable. So about 1,000 people I've taught, 2 people I have not given it to. One, because of a very rare eustachian tube thing, and I was in an ENT clinic. I approached the audiologist, and we specifically were like, that's not for them. And then the second person had a very rare lung pleura condition where if they took deep breaths, the sensation of active taking deep breath felt like they had sandpaper rubbing up against their breathing. That would have not been beneficial. If someone has incision and recent stitches and sutures, you don't want to have a pressure to go against that. If anyone has a cardiac issue, I was surprised that the doctors often said, this is great for that, because there are swallowing exercises. If you have a breathing task that you brace and you put pressure, that could be sensitive on the heart. There are a list of things, but not many. And I like the breather because it can be so subtle. I've had patients where extremely weak and lots of anxiety behind deep breathing because they've passed out. They've just walking up the steps and terrified of breathing, or they can't stand in the shower long enough, I would have them do just 2 breaths. And we would find the least amount of resistance. But I like the breather because we can work on the breath cycle of inhale to exhale, because that's how we live. And if you can't engage specifically the muscles for respiratory muscle training, we have our accessory muscles, we have our internal intercostals, so the muscles between the ribs, and you have one specifically for exhale and specifically for inhale, and the diaphragm. And we give so much weight on what the diaphragm does, but there are other pieces. And then we also have our posture of our core and our pelvic floor. But that resistance of the rib cage movement is where I see my patients benefiting leaps and bounds that I've only been able to embrace when I use the breather.
Yeah. Well, you know that I'm, of course, going to bring up the alignment, posture, intra-abdominal pressure, bringing in the body, and of course, how we build and manage that pressure, and how we continue to go throughout our lives, perhaps coming into adaptive patterns. Other people might call them compensatory patterns. I like to call them adaptive. So coming into an adaptive pattern that might not be serving us any longer. And how we can actually collaborate and work together, because we want to make sure that in increasing respiratory demand, we're not throwing someone further into their adaptive pattern. But giving them more options, both in respiration and to make sure that their major joint complexes and their tissues have these options. So I know you have, we've had a little discussion about this as well. And just bringing in the idea that when working with someone with increasing respiratory demand, I believe it's very helpful to also be working with someone to make sure that we're not continuing to throw them further into an adapted strategy.
So what I love about RMT, specifically, I'm going to keep coming back to the breather because I've bought a lot of them with my own money. As clinicians, we don't really get test samples often. And I've bought this, I bought other ones, I bought the traditional ones that we know, and other patterns. If you have that pressure threshold, I don't like that one specifically because you have to put such force. Now, of course, it has the adjustments, but you have to put a force that those accessory muscles come in, and I have to untrain that adaptive pattern while they're learning a new skill. And I'm not a fan of having to teach a new thing and have to untrain something while they're
Well, no, untraining is way harder than teaching something new. So.
Yeah. And then another thing is when it's just the expiratory or just the inspiratory, I'm finding the patient or the singer or the professional speaker, because I do that too, that they are now learning a breath holding pattern at the end of that task. And I love to have it a combined task, and we can make it in isolation. But the way that this can go in, specifically that the inhale and exhale does not have to have the same level of resistance, because our inspiratory is not always the same level as our expiratory strength, those internal intercostals versus our external intercostals. And we can adjust that. The other thing is I have found this. Its specific benefit for what I've seen is that maladaptive or compensatory falls away when we get that relationship of the rib cage involved, because I've seen it, that collapse. And then, especially in our singers, they will get tight abs, super tight abs, but the ribs aren't moving. This drops that entire scenario, which was my relationship, and even very little. Like I was pretty good at that relationship, but I could have gone a little bit better and further. When I added this, I did. And that tension disappears, and it brings it to the right zone that your body's stability can use. That also helps us with that alignment. It's helped people improve alignment. It's helped people increase their exercise tolerance and reducing anxiety, because deep breathing is like a massage for the nervous system, but it also can bring out those feelings and emotions. So I've had many patients cry in session just because voice is such a vulnerable self. And I respect that and take that into account with people. And I might say, let's just work on inspiratory until that expiratory, or vice versa. Or let's only do 2.
Yeah. And I do want to recognize that, obviously, because of my own history, that sometimes coming directly into breath training can be more than a nervous system is ready to handle. So taking steps to prepare someone to be able to come into respiratory training, I think, is really important too.
Yeah.
So
I currently have a new person that I'm working with who had their voice change after an emotional trauma and things like that. And I was like, this is going to be great for you. I can already tell the collapse of breath support that you're having in the tone. But I saw that tension and anxiety come in. And I said, let's try without. And in about 2 sessions, many people I could introduce it right away, but just to get that breath relationship, and then add this for a breath or 2, and then grow from there. That's why I love its flexibility.
Yeah, and I started sometimes with different people in kind of more of some kind of vibration, or more of some kind of, tapotement tapping or rocking, or just to help the nervous system to be able to start to regulate. For myself, the word breath was terrifying for years. So I personally kind of changed it and often teach it as an internal massage. So feeling the massage of the heart against the lungs, and then the lungs massaging the heart, and the diaphragm massaging down into the organs, etc. So I'll go through a whole idea of internal massage, etc., to kind of hopefully change the perspective of I have to do this, or I have to breathe, or the emphasis on being something, when the word itself can be quite alarming to some nervous systems.
For some people, I've said, I don't want you to think of this as a voice exercise, especially some people with significant dysphonia associated with an emotional piece. And when those individuals come to me, I love a co-treatment. I love having our individuals go to the many professionals that benefit, whether that's a therapist or a PT or getting massage or things like that. Because, there's so many exercises that help our people, but they might need to take steps to unlock those before they're ready. And one thing I like to do is also visualization. And I say, forget it's a breathing exercise, forget all this. I just want you to think about the waves moving in and out of your body. But they're going down and they're coming up. Kind of like the waves rolling onto the beach and rolling back in. So that may be one that we like to use.
Yeah, so I'm going to get my breather out. I have 2 different breathers here. I'm not ready for this one. I already know. And maybe actually, why don't you tell us the difference between these 2 breathers?
So the breather specifically, because it is my favorite, and it doesn't mean I won't use other ones, but 99.97% of the time, I will use this over any other one. That the blue is the breather. And there's also a pink color. They're the same level. And I would say this is for the everyday individual to medium level of difficulty. And I'm not going to undermine that this is not even a challenge at the beginning, because it is. For some people, they're ready to go to level 3, but they might be on 1, and that's where they need to stay for a while. So the breather, the blue or pink one, is your everyday individual to medium. The breather voice and also breather fit, so we have the burgundy for breather voice and the black one for breather fit, they are the medium to advanced. I'd say if you are a conditioned athlete who's competing, if you're a professional singer who's been training against resistance and challenge, and breath work is a big piece of what you do, this is a great place to go. And then you can always go here and increase to here. But I, as a professional opera singer, find benefit in both. Depends what I'm doing. And if I'm going for stage, I'm going for this. If I'm living life and I'm around the house and I'm not doing too much, then I will find benefit in the blue one.
Yeah, so no judgment, because I said, I know that I have to do the blue. And you're all saying, but Christine, you teach movement and we talk voice. I can tell you right now, I have to start at the blue. I have a lot of scar tissue and a lot of emotion around breath. So I will be starting at the blue level, and I want to honor anyone else who is a professional singer or even a fitness person who also has to start at the level of a blue. You are with me, and I see you.
And I'm going to bring the point. So the level 3 on this is level 1 on this. So this automatically you're starting on 3 and going up. Your inhale and exhale can be changed independently. The reason why the shape it is so that you can hold it easily in your hand. If you have arthritis or carpal tunnel, you can just palm it and rotate it. The first few times it might be a little stiff, and you don't have to have inhale and exhale change at the same time. You could have a very exhausting day, or you could have like a medical treatment in the morning, and you typically are on a 3, but if that day is really hard, then go to 1. And I have people who I coach, who are coaches for professional touring artists, and they're on level 1 for inspiratory. And you'd be surprised. You're like, what? And my friends who are Metropolitan Opera singers, I have them on level 1 for inspiratory here. And they're like, what? Because that little relationship of that inspiratory sensation they get, it really takes the pressure off of here. And that's what I'm obsessed about, is really getting that biofeedback, that tactile sensation, the visual if you have it, but really that relationship of connection. Because we don't want to be stiff. We want to be buoyant and flexibly engaged. And that's what this really is, like a good resistance band.
Cool. Okay, so I just brought my inhale and my exhale to a level 1.
Okay.
So let's start at the beginning.
Okay,
what am I doing?
If I've never met you before and you've never seen this, and this is basically your first time ever using it, I would just have you put your hand on your chest, your hand on your belly, and I'd have you take a deep breath for me. And you can do nose or mouth. People are always like, which one's better, nose or mouth? Well, the nose is natural filtration. It does get warmer going down to the vocal folds. If you ever find yourself coughing when you take a breath in from the mouth, it may be because it's colder or it's coming in quickly, and that could be irritating for people. I like to, with the breather, I like to start with a puppy pant. So I would like for you to take a pant like puppy dog. And that automatically get someone connected down to the lower breath. It's the coolest thing. I stumbled upon it. I use it in clinic because we don't want to overthink it. It's so easy to overthink our body, but we live in it every day. We just have to unlock something that maybe we use in other parts of our day, like laughing or playing with our kids, and we get that good belly breath. So let's bring that in a less stressful way. So pant like puppy dog. We're just playing. Okay, now your throat, when doing the puppy pant, you're relaxing the larynx. It's opening more. So this entrance of your airway is and this is the upper airway. Anytime vocal fold above is your upper airway. You just lowered it and opened it to be most easy to get this to move. So that's why I love that puppy pant. So you got your deep breath. Now I want you to close your mouth and just take that breath in with that same throat shape. Okay, more release and connection here. And of course, we always want to know that it's not just here moving, it's our ribs. So many people are like, well, at least for me, if my lungs are what I'm breathing into, why is all this moving? Our diaphragm moves down, our guts and intestines have to go elsewhere, and our pelvic floor also drops and things go down in there. Are you also a fan of sharing that knowledge with your audience?
Oh, yeah, definitely. Yeah, the pelvic floor buttresses against the organs. So they come up, buttress against it, and then descend with a respiratory diaphragm in resting breath. So it shifts and changes once we get to the point of more forceful exhalation, like shouting or like some forms of singing.
And sometimes our teachers would be like, I want you to feel like you're really pushing on the toilet for like maybe those bracing big loud notes, because maybe they want you to feel that pelvic floor a little more for those. And over time we realize This also does a lot of adjustment. This is a flexible space, but when you get control of utilizing this like a valve, everything gets easier. So I'm a big fan. All right. I'm teaching you as if I'm teaching a clinician, by the way. If I just picked you up off the clinical space or in the vocal studio, I'd say, all right, I want you to pant like puppy dog in here. Great. Now I want you to breathe in through your nose and then blow. And breathe in that puppy pant with the breather, with that open throat space. And exhale. Another trick I like to give is I tell people to salsa. Because we cannot have those accessory muscles overcompensating, we can move our sternocleidomastoid side to side. Okay. Any observations on doing that little movement, using that pretty much for the first time?
I mean, both felt accessible.
Okay.
Which is good.
Are you feeling comfortable?
Yeah.
Is this
I'm good. No.
Okay. Now, with the breather, this is resistance that we're using, not threshold based. So I want you to push your hand against me. All right? I want you to barely touch my hand. Barely at all. Let's go from 1 to 10. About how much pressure are you pushing? 10 being the most.
0.5.
0.5. Okay, now I want you to give me a 10. All right. Do you also feel when you do that exercise that this comes to work? That's a cool thing about this. You can have people do that here or handshake. So that's really great because that's a sneaky trick to let people feel that relationship. Okay, so give me a 10 again. Now I want you to give me 5. Okay, we're a little bit, we're connected, we're engaged. Kind of like a resistance band. And you feel that here a little bit? Okay, now I want you to pant like puppy dog. Feel how this doesn't collapse right away? Okay, now I want you to use this 50% exertion for individuals, and I found over my time using it, and you and I have a very fun time chatting about these populations, individuals with unique conditions, and not many people can relate, such as EDS, Ehlers-Danlos, POTS, things like that, and there's such little knowledge. I like to tell people to be kind of on a scale from 1 to 10 of effort, and we call this your target level of effort for the breather and resistive training. Use the diaphragm, not the accessory muscles, but also what's your exertion. So on a scale from 1 to 10, I'd like for you to be in the 50% zone. Just the everyday individual, I like to have them in that 50%. All right, so take that breath in. I like to inhale, surprisingly, with the mouth, because I automatically squeeze my like that neck. That I still do that, and so do lots of people. So I want to avoid that with a puppy pant breath in, and then put that 50% exertion from here, and breathe out. Now I want you to breathe in with that 50% inhale. And do a little bit of salsa in the shoulders. I'm seeing a little bit of this going on, okay? And then I want you to exhale again. And breathe in. Right into here. Good. And exhale.
Inhale is way easier than exhale.
Okay. And I was actually going to say that too, and I'm surprised because many people, not so much. I would like for your inhale to actually go up. Because if we use a weight at the gym, and I really want you to build a relationship with this device and just play with it, explore, and play with it by increasing the resistance and how much effort you're giving. Until you go to the gym and you haven't been in months, you're like, I don't really know which weight to grab. You'll go and you'll explore. You'll pick one up. You're like, oh, that's not enough. Oh my gosh, that's way too much. Find that kind of sweet spot of that kind of tug of war that we did. Not too much, but enough to get you braced and to get together. So increase that inhale.
Okay.
Good.
So I went to 3.
Good. And I like your exhale to go up to 2.
Okay.
Over time, what you'll notice is that it has that leak of air for that suck in and that blow out of air too. That's the side diaphragm that air is actually resisting against. If you hear it go, versus, let's see, that's like a 3, my exhale. Well, Let me have the highest level. Then I'll go to this one even higher. Listen to the speed of that air exiting if you can. And this is like, ooh, it's very slow. But when you go too weak, this is just going to collapse. And it's going to rise back up. So when you're exploring, just like going to the gym, which one's kind of giving you that, okay, I'm connecting to my body, but it's challenging me a little bit. Okay, so let's have you do that for your exhale on 2, your inhale on 3.
Exhale 2, inhale 3. And it goes up to 6 on inhale and 5 on exhale on the blue. Okay, so I'm going to inhale through my mouth like a puppy.
I like to do that. That's my personal quick trick.
Okay.
And then exhale. And inhale. You feel kind of that connection. I can definitely see that better. And this is not being sucked as a compensatory as much. And I like to kind of roll their shoulders back. You're a very physically engaged person. Want us to kind of like still make this massage-ish. Now, when using the breather, keep going. You may get dizzy and lightheaded because you're not used to that level of carbon dioxide and oxygen gas exchange. It's a different level than you're used to. So if you get dizzy and lightheaded, you don't work through the dizzy, you pause. I'd like you to do about 2 or 3 more inhale to exhales. And let's make this a fun visualization. Imagine those waves rolling in and going back out on the beach. Connecting that exhale into your inhale a little more.
So I'm going to pause because I'm slightly dizzy. So I will pause for the dizzy.
You pause
and then I'll come back for the waves.
And I have this handy dandy fun visual because so often people like to rush that minute. So I'm going to make you wait that solid 60 seconds. So essentially, I took longer to teach you how to do it because I want you to be pro, master, awesome at it. I could teach this someone in 2 minutes less. Have them do that puffy pant to get that diaphragmatic breath. Tell them about that 50% physical engagement. And they yawn in, they exhale out. And you as a clinician will be like, oh, that's collapsing. Or this is overcompensating. And you help them relax that or increase or decrease the resistance until you see kind of that engagement. I like to talk about Simone Biles. She's a very famous gymnast if you haven't heard of her. And she won't be tight to jump her body, right? She's connected, engaged, flexibly strong to do those movements and not stiff. And this is a workout.
Yeah.
This is a workout. Well, I'm not going to say anything. What do you think about it?
Yeah, it's definitely a workout.
Okay. And with everything you've been through and the long journey you've had to come to be open to working on your breathing, how are you feeling?
I feel good. I definitely have a connection with the exhale. That's what's triggering.
Was the device they gave you an inspiratory or an expiratory?
Expiratory.
So I would love for you to have a visual of whatever that may be that, you know, makes you happy. Or we can even turn on music, or you can walk around the room to a point. Because if you're doing resistive-based breathing or threshold, moving around the room, that's a whole nother level of challenge. Now, that's also where you can go with the breather. If you are someone who needs to practice not holding their breath while they're walking, believe it or not, people do that. You can walk just a few steps on your kitchen to your kitchen counter. You can do, okay, I'm going to walk the island and back, and then I'm going to sit down. And you can use a breather. Or if you are a athlete who holds their breath or uses their sternum for their breathing and they don't match their inhale and exhale for exertion or contraction, we can use the breather while someone's doing slow crunches. We can have the breather while someone's doing plank. We can have the breather while I just bring it into what is your challenge, and then let's make it functional. But I have them master that, just what you did. And you can do that 2 times a day. If you feel like you're able to give good quality and quantity, I would love for you to work to 10 inhale and exhales with a 1-minute break and repeat. Some people, if you feel like, okay, I'm not going to trigger that fight or flight if I do 5, then just do 5. And you could do 1 round. And you're like, I feel good. I'm going to do 2 rounds of 5 or 3 rounds of 5. You don't have to have an exact protocol if you're not doing a research study. You know,
but really you're working someone up towards being able to do 10 and then twice through.
Yeah. And I've had people successful doing 3 inhale exhales, 4 rounds twice a day, and have had major changes in quality of life and voicing and everything like that.
So how do you know when you are ready? Is it really what you're hearing? So when I start hearing it happen pretty quickly, I know that I'm ready to progress or scale up.
Yeah. Always checking, okay, am I relaxing this? Because that's what I love about the breather. It takes the effort away from here, because I'm not going to put words in your mouth, but where did you feel your breathing connect for you when you were using that?
Oh, definitely bucket handle.
Bucket handle. Is that really easy to access that sensation?
No. Yeah, it's not. Well, especially because which is part of what I teach, but I have a very straight thoracic spine, which is why pectus, it comes along with pectus excavatum. So I have that very straight thoracic spine and a 90-degree rotation of the sternum, which is not part of pectus excavatum. But in the area that I am trying to help myself find more curve, a natural curve of my spine, is right there at from T8 to T12. Guess what? The levels where we actually have the hiatuses of the diaphragm. So where our major vessels come through the diaphragm is often where I feel it. So being able to have bucket handle motion, which I teach a lot, is not easy for me to access from my history.
So I'm just asking you organically, is that exciting for you to have that relationship that you just...
Yeah, it definitely gave me more of a relationship with that area that I seek to find. Yeah.
And then I want you to think about maybe your patients or clients that you may be doing, and I don't know if your audience knows, the 90-90, where you're sitting on the floor and your knees are up and your back, and you're working on maybe we crunch one side of the abdominal to get that, because our diaphragm is not equal on both sides. One side is higher than the other, and that we can do that. But you can also add that and that inspiratory piece, which I love. Yours, you find you love that exhale piece, but it challenges you.
But I've also worked very hard on inhalation. So I do waterfall breathing, where I inhale, pause, because inhale is not usually where I exceed. It just happens to be today. I don't know what's happening today, but it just happens.
Because you train that. You train that waterfall breathing. That's elite.
Yeah, and I do I guess forms of it without knowing, because I do use straws with the movements, and I do use kazoos, and I do sometimes, if someone is ready, use something like a balloon, which balloons are really hard, so I rarely ever use balloons. So
I have exactly what you mentioned. Right away, I would like for you just to use the breather for about 3 inhale, 3 exhales.
Okay.
Now, the amount of time you do can also vary. I love to teach this as just the go-to we do, because I want people to have this relationship with their breathing. It pretty much mimics your kind of pace of breathing throughout the day. What I love about the breather is we're getting that biofeedback, where you're feeling a biofeedback, tactile feedback here, but also you're training your nerves and your nervous system and your neurons. The neurons are firing and making that motor memory connection. And this is when that breathing becomes automatic in your day. And I love that, that retraining of your breathing cycle. And then we can tax it with more resistance, more physical challenges. Also, if you're someone with a weaker swallow, you can have a greater level of resistance and breathe shorter amount of time because you want to have like more of that intensity. But I love to teach this as a basic so that you really know where am I supposed to be working my body to increase my challenge to sustain that quality of technique under challenge.
Yeah. I also have, just for those listening, I think it's very cool. And if you know my language, yay, that's even more helpful. But if you think of a Rubik's Cube of pelvis, sternum, and neck, I am left, right, right is my pattern. So as I'm actually sitting here with Katelyn, I'm actually biasing my pelvis to the right, which is opposite of where my pelvis naturally is. So biasing my pelvis to the right, and by turning to face you, I'm biasing my sternum to the right and my cervical spine or airway to the right. So I'm actually coming out of my pattern in order to look at the camera. So I'm coming out of my adaptive strategy as I'm working, even while just sitting here. So just to let you all know that I am actually actively coming out, or have an intention of coming out of my adaptive strategies or my lateralizations, even just with sitting here while I come into my waves.
Okay. And if I may, that entire segment of communication you had, your voice was the clearest for the longest duration you've had in our encounter. Now, I'm going to give that to the breather and how it connected you to your body and how you utilize your air and how you replenish that air and you've supported here. That's that motor memory component, that retraining. So for you, I love that you are open to doing this step for you because you have an important voice and you use it all the time. And I want you to feel strong in it.
Well, and you can see that when I talk to you, I'm coming into my pattern and I get instability. So I'm coming further into my adaptive pattern by looking this way. But when I shift to look over here, you can hear it in my voice right away. My voice is such a very cool way of seeing when we have gone the appropriate way because it responds so quickly. Most voices do if we learn to listen, but mine, because of scar tissue and everything, is very clear. So I'm sure that all of you heard that too, and if not, no worries, but most of the demographic are speech therapists and voice teachers, so you probably heard it. Okay, that's a wave.
Okay, let's wait. So I want to actually have a visual of a wave.
Okay.
And use the breather 2 times, and I got you a balloon. Where did I put it? I got you your own balloon. Give me 2 seconds there. Well, that's my balloon. I don't want you to use my balloon, but that would be kind of gross.
Okay.
I got you your own. Oh, here it is. I would love for you to use that.
Okay.
Use the breather and then use that. And give me your comment of how challenging that is. Okay. One versus the other.
You want to push me through a wave?
Nope.
Okay.
I'm also going to bring attention to, you're like, well, I'm seeing things going in and out. When we are more slender, and you are very nice and strong, and we can see when we have air filling up a space, it can fill up more. So if I am doing, you'll see this, because there is a suction pattern. The accessory muscles are involved in breathing, but I'm not. That's what I want you to pay attention for. If you see, especially if you are someone who is more slender, then you may see more of this movement happening. It doesn't mean it's wrong. Okay. Would you like to contribute anything to that?
No, and we'll definitely see those muscles, especially I was a long distance runner. So platysma, this muscle sticks out more on long distance runners. SCMs, but that's because of that respiratory demand. I do tend to have a little too much accessory, so I have to pay attention to it for sure.
So I got in a little bit of salsa for you.
So it definitely helps to like move around a little bit and not have too much accessory, especially because I was a long distance runner with respiratory issues. Yeah.
Now I'd like to try the balloon.
Okay.
Let me know what you think. Okay, now take a break.
So, definitely I've blown up I've worked with balloons a lot. So I already know how my tendency is. And in my tendency, I do a lot of accessory breathing. And so this was definitely far less with accessory than I have previously.
And so would you say that filling that up is a challenge for pretty much, you'd be surprised. I have people all the time say, these are trick balloons. These are not real balloons all the time because a grown adult without some breathing deficit, they are using here.
Well, in our hands-on class, we didn't in this last one that we just taught, but we often have people blow up a balloon at the beginning of the class and then the next day blow up a balloon again and or at the end of the day and experience the difference. And so being able to see a room full of people trying to blow up a balloon, it is not easy to blow up a balloon. So we forget that.
Yeah. So when someone says, is the breather like dangerous or hard, or is this okay for my patient? I'm not going to say specifically for every single individual in the world because everyone has a different history, and that could be an emotional history. It could be a scarring. It could be. So generally, the breather is not as hard as blowing up a balloon, and you can grow with it. It has that resistance. So if you feel safe to give your loved one a balloon, the breather can actually be a step to get them ready for a balloon. And you might not need that balloon because now you can also have that inspiratory piece that all of a sudden is disconnected and collapsed when you're using the balloon because you're just getting that reinforcement with the exhale. And you're like, instead of that. One patient of mine mentioned that they like to think about using the breather as how their kids take like medicine, and you have a syringe and it has that suction that just doesn't disappear when you're doing that inhale to exhale. And I love that as a visual and to think about the rib cage. Now, another trick of mine is I think of my throat as a hallway. I'm like, nope, it's a hallway. It's a hallway. And if I feel any tension, I wiggle my shoulders. And I like the idea of doing a little salsa all the way down because you connect to your pelvic floor and you are not stiff in all those zones. And that's where a lot of those singers are, is they're just tight or disconnected. Agree or disagree?
Definitely disconnected.
Yeah. And this connects. And when you're singing a phrase like, Sapere foreste, now, that's not one I ever learned because that's more of the alto, but I'm more that soprano. That exhale, they're singing supported because it's against resistance, against a sustained note. The vocal folds kind of have a decrease of how much air is exiting, giving you kind of that sensation to engage. But when you inhale, it's like, instead of like, I'm not sure if anyone else is in the house that I'm doing work, but it connects you the whole time to this rather than sing supported, collapse, rebuild, collapse, rebuild. It gives that feeling. Now, I know we talked about the bay and the ocean, but it really is, I want you to watch the ocean in a video. I want you to see how the waves roll up and gradually come back. And it's not this perfect, like, I'm a line of ending inhale, now I'm going to exhale. It's you roll up and it's just a constant movement. And I like to think of the bay versus the ocean. Lots of people breathe in and they're like, and I'm like, let's go to inhale up the bay, or roll in the water. And exhale. So if we're thinking too physically or tension-wise or body has to do all the, I like to take it all away and just breathe with the beach. Now, my phone's not really loading an image of the beach. We can upload one right now and you can do the breather. And I want you, I'm just going to talk it through of your inhale. And I will be your beach for you.
Okay.
Okay. So I would like for you to close your eyes and just enjoy that relaxing nervous system massage. Okay. Puppy pant in. That's my favorite. And exhale that water onto the beach. Rolling those waves in. Cooling down and out into those, and exhaling that right back onto the sand, rolling up the beach and getting ready to pull back in slowly. And your throat is a hallway, and think of being in the Bahamas, and exhale. Now, give it a little bit of more exertion. And exhale. And keep that 50% engagement just to get that workout in now. And exhale. Rolling right up to the water on the sand and rolling back into your body, back into the ocean. You can do a few more if you like, or you can take a break. Calm. Trigger that fight, flight on that exhale.
No, I'm just getting sleepy.
Yeah, that's nice. So if I'm overwhelmed as a mom, I will grab my breather and I will just sit down on the floor, my back against the wall, and I will have my knees up and I will just, or crisscross applesauce and breathe. And hear maybe glass falling on the ground somewhere, but I'm going to calm down for a few seconds and then I will go up and say, hey, you, and, then get back to life. Or before I get on stage, I will sing a set and then I will walk off and I will do that. I'll just do about 2 or 3 inhales, go right back on because maybe I just have one song to take a rest. And I call it my recalibration. It just recalibrates me right back to here in seconds because I've already done all that motor memory learning that my body, it gets to you. It gets you in that place and super quick. It's a relationship I haven't had until I started using it.
What are other, so this is the breather and you work with the breather.
I now work with the breather and I teach in services for hospitals, clinics, and if anyone has questions, you can reach out and I am happy to teach you for your vocal studio, for your workshop, and see about getting you the best deal you can with a breather for a group and things like that.
Yeah, and before we get to how to contact you, what are other respiratory or RMTs or respiratory training or therapy?
Well, you can do a variety of things. You can always have a balloon. I don't like the balloon solely because you can mimic that here and change the adjustment of resistance as you need if you want.
I think balloons are really, especially because we use them in a physical therapy setting. This is as mentioned, this is very high. I don't have a lot of singers that are ready for a balloon. Anyway, so I have some people come to me that are working with other physical therapists and they're really struggling with a lot of accessory musculature and possibly like having just had a hemorrhage. And this is way too much. So I do want to mention that too I know we have a number of physical therapists and body workers that also check this out, so thank you. But starting with something more mild than a balloon is a really great place to start.
Yeah, and the thing is if people need to work on their breathing, but their life posture is here, a lot of other devices, I say you have to sit at a table, you have to have your elbows on the table and then breathe and use this version. That's one of the descriptions, I believe, Aspire. These devices, they have research. they back them up. The breather, it was the original respiratory muscle training device invented 40 years ago, has helped millions of people. There are so many research studies on it. And combined respiratory muscle training, there aren't as many devices that have a independent dial change. Some you'll get one and you can do inhale to exhale, but it's at the same level. And you just said your inhale is better to support you, and your exhale is something you want to take a break from, sometimes maybe, and then you gradually move into it. Also, if you are in this posture, the breather works perfectly fine for that. And it helps support that strength that gets people moving closer to upright, and because you are still connected, you can't neglect how your pelvic floor is part of the breathing cycle, or your abdominals, or your back. And so when you're strengthening those muscles between the rib, something's going to happen. Other things are going to be moving and changing too. Now, I want to always say that you do what makes you feel comfortable and safe. Don't work through the dizzy. Take your minute break. You have really strong athletes. I have a Pilates instructor. I'm like, yes, you're strong, but you need to just let that oxygenation, carbon dioxide balance out for 1 minute.
Coordination before strength.
Yes. Because you do sets all day, yes, but quality declines and that connection. So things you can do is you can wrap some tape around your ribs and notice that breathing pattern as well. You can use your lips to create resistance. You can. So, but people tend to add that piece of the component of the accessory muscles here. You use the breather, you trained how to do it. Now I'm like, okay, take this knowledge and apply it to the lips. And now let's have you do, can't remember the word, but the Pilates machine while doing that. And the reformer, and they're using resistance-based training. So anytime you have a tube, your upper airway, that changes the resistance, which your lips can mimic resistance. Breather's great. Other devices are great because you can have a set threshold. And you can go back to it, and you can reinforce that. And if you need to go down, you can. When you do, you're not always at the same. The balloon doesn't include inspiratory, but that's okay. You can sometimes just target expiratory. There are benefits of just maybe you're working on a sprint and you want to practice that exhale only, or you are working on preparing for that long phrase and you need to get that inhale prepared for that long phrase or going to sustain. And then you can have a straw, and the straw, you can squeeze it and breathe into it and make that change of resistance. So breathing against resistance is essentially, or a threshold, resistive breathing. I just like using this because it makes it hyper aware when you're adding other pieces, and it's easily to access that underutilized piece.
So I'm already doing it without even knowing what the devices are.
Exactly. And I got even more. And then you got other things. So the change of the diameter of the straw makes a difference. And then also it's really the diameter that's big. The distance, you're extending the vocal tract, that's a bigger thing for voicing, for semi-included vocal tract exercises. And that's the difference too. The breather is to target the breath. The semi-included vocal tract exercises is to help balance the pressure of air above and below the vocal folds behind the lips for getting the vocal folds to come together. This is not with your vocal folds coming together. Can you use vocal exercises? Yes, you can. I like to grab my straw for that, but this is what gets me ready for all the voicing I do later. I always start with breath and body first, then I add the voicing. All right?
Yeah.
And then you can add fun, handy dandy things like this. I imagine if I had a ball and you're just breathing against a tube, which is causing resistance, and then this slows down this collapse.
That's so funny to me because that immediately triggered a stress response for me, imagining a ball, because there was a ball. So any of the ones that have a ball training, which I've tried, I've ordered some, and I can't. Yeah, it like immediately just, makes my nervous system respond.
So this is also a very subtle
I love kazoos.
Oh, yeah. Subtle expiratory target. You need to do it with voicing because, again, this is now adding a pressure threshold resistance. And I like to add this. My individuals work on this. And then I'm like, okay, let's do pursed lip breathing, doing our physical task. If they're our singer and they need to work on their staging, or if they are our Pilates instructor and they need to work on how they use the reformer and now they're not holding their breath or they're not using this, I then have them gradually move to that.
A kazoo.
Yeah, so that is a voicing against resistance, and that's exhale only again. Where's that inspiratory piece? So I like this because when we're working out a muscle, it's there to support us throughout our day. We have to engage it and activate it. But if you've been lifting your muscles all day and then you have to climb into a truck that's lifted, or you need to pick up your kid, or you need to sprint, those leg muscles are there. You've grown them. You've lifted them. But are you utilizing them with the right technique? That's the thing with the breather. There is literally evidence that when using respiratory muscle training, that the lining of the diaphragm thickens after 2 weeks of using resistive base training. And same with those inspiratory and expiratory, internal intercostals, external intercostals. Those are muscles. They can be stronger. So your inspiratory and your expiratory muscles can be stronger to support you through the day. And then when they are stronger, doing other exercises and voicing tasks and things like that, those muscles didn't just disappear. And you've also ingrained that neurological motor memory pattern to activate them and fire them, and it's easier to do.
Cool. Yeah, I'm going to blow through this because I opened it.
So I'd like for you to do a speaking task, speech pitch. See how long you can last on your exhale, and then see if you can get that inhale with your nose with this relationship now. And imagine if you were on a reformer and things like that. But
buzzer isn't working, but
yeah.
coming out.
But
yeah.
What did you think about using the breather and now doing common tasks that you typically do? Any change in relationship?
Yeah, definitely way more connection to the area I was talking about with bucket handle. My lower ribs, expansion in a multi-directional.
I'm an opera singer. I like to flare out big. Like that. But then I've had to learn, you and I have training in you more than myself, but I'm very grateful that I've had postural training and exercises that you and I like to nerd over, and a little bit of squeeze here and the pelvic floor and tilt and all that, and just applying that strength that I now have. And so many devices exist. Find the one that works for you. I've done a lot of the heavy lifting to find ones that I like and know how to apply them. And I hope you go explore.
Yeah, amazing. So if someone wants to explore by learning more about the breather, or wants to say like, Katelyn, you're awesome and I want you to come teach for my voice studio or my clinic or whatever it is, how do they get in touch with you?
Because this is just one of the pieces that I work on. I work with public speaking. I work with stage presence. Performer and rehab specialist for voice and upper airway and respiratory muscle training. So if you want to get a hold of me, I'm Katelyn, Katelyn Swiader, Swiader, on all socials. And you can email me, Katelyn, Katelyn, at soundwavesvc.com. And the breather is www.thebreather.com. And if you have questions about it, on the bottom of the page, they have email addresses, how to get a hold of us. And myself and the chief scientist are actually the ones who answer the questions. So you can go directly to the breather and contact Katelyn as well. Amazing. Yeah.
Katelyn, so thank you. Thank you so much for being able to, it was Katelyn's idea to actually do this in person, which is awesome. We were here in Virginia Beach. Why not be in person? So I'm so grateful that you came here to my home and met me here to talk through the breather with me, to coach me through using the breather, and to be able to reach out to the audience. Thank you so much for coming. Thank you all so much for tuning in, and I look forward to seeing you next time. Yeah.
Thanks for tuning in to the Visceral Voice podcast. If this conversation resonated with you, please subscribe. It's free and it helps us keep sharing meaningful content. A quick rating or review also makes a huge difference. Share this episode with your colleagues, students, and friends. Join us on social and visit www.thevisceralvoice.com to explore programs and upcoming events. I hope you'll join us next time for another inspiring conversation on the Visceral Voice.